health emergency that may be able to visit our shores here in Africa. I would like, however, to pay very special tribute to our member states. These are our employers as Africa CDC. We are an organization that is made up of 55 member states, and very, very special tribute to our member states who have addressed themselves to health security in a way that has made our work of supporting them much easier. So to our member states, we really, really thank you for your confidence in us and the support that you continue to give us whenever we need your help in any way. So this side event today, we would like to discuss that value of partnerships. How can we be able to utilize the strength of the existing partnerships to be able to prepare even better for the next outbreaks that will come? I'm avoiding the pandemic because if we do things smartly, there'll be no more pandemics. There'll be outbreaks, we arrest them, and then we wait for the next one to come. But how do we harness the partnerships that we have so that we can be able to prepare better for the next outbreak? How do we ensure that when we are preparing for the next outbreak, it is actually strengthening the whole system rather than picking one type of disease from the other? And I would like to persuade you yet again that by partners supporting implementation of our new public health order, then we will definitely avoid another pandemic. So if there is anything that you come away with from this conference, from this session today, it is that let's support implementation of the new public health order by Africa CDC, by our member states at country level, by our regional organizations, by all partners, the new public health order. And when we do this, I assure you that you will make our life a lot easier at Africa CDC, and I assure you that you will make the health situation on the continent a lot better. The Africa Union Commission is our host as Africa CDC, and although Commissioner Minata has to go to another session next door, we were having a discussion just before I came, and the assurance that we are getting from the leadership of the Commission is such that we feel very confident having discussions here related to implementation of the new public health order, because the new public health order speaks directly to Agenda 2063, the Africa we want. And this coming year is the year of review. How are we doing with Agenda 2063? And I think the work that we've done together, we are proudly going to be laying on the table the progress that we've made in implementing our new public health order, and therefore by extension, contributing to Agenda 2063, the Africa that we want. This conference is a vehicle that we would like to grow, and we cannot grow it without partnerships. The conference speaks directly to each and every pillar of the new public health order. I invite you to walk with us the journey of making the Conference for Public Health in Africa stronger every edition. We cannot be able to do it without you. And I, therefore, would like to encourage that as you plan ahead your strategies and, of course, your budget, please, let's remember that there's going to be a Conference for Public Health in Africa every third quarter of the year. Finally, ladies and gentlemen, I would like, as we discuss today, to really focus on actions that can be able to give us early results. Although we'll be planning, and strategic plans are usually about 5 years in length, let's also remember 6 years of the existence of Africa CDC. I welcome all of you to this session, and I'm looking forward to some really fine discussion from all of us. Thank you.
Thank you very much, Dr. Ahmed. Please, another round of applause. Thank you. I'd like now to call upon Dr. Teresa Madubuko for the introductions and objectives of this wonderful session. Great. Maybe Dr. Teresa just want to wave to the room. Thank you. So quickly, we now move to Mr. George Momanyi. He's going to give us an overview of Africa CDC partnerships and the new public health order. Mr. George.
No, thanks, Fiona, for that introduction. And again, let me say welcome to all of you who've been able to join us today. It's really a pleasure that we congregate here today to talk about the partnerships that we've been able to build as Africa CDC with all of you in the room, and many of us who are not in the room, but then we really value, the support that we've enjoyed from all of you over the last 5 or so years of Africa CDC existence. So this evening, I wanted to take a moment to walk you through, a quick presentation to try and showcase the kind of partnerships that we've been able to build over time. And as we go to the next, slide, it more or less gives a quick touch on the Agenda 2063. Now, and again, our director has already, highlighted it very well that this is the main framework of, for Africa as we look forward to how we can move to the real Africa that we, all of us, want. Yeah, next slide, please. Yeah, so what you see here is a quick summary of what is contained in the whole Agenda 2063, but then more or less to give an impression that, Africa as a strong and united, resilient, and very influential global player and partner. So we are coming out strongly to engage with all of us who are here to ensure that we can all in a way contribute to the Agenda 2063, which is really the Africa that all of us would want to see going forward. Let's go to the next slide. Yeah, so one of the other key documents when we look at the Agenda 2063 is also, the AU Health Strategy 2016 to 2030, which is also focuses still on the overall agenda that is in Agenda 2063, but more so to build an effective Africa-driven response to reduce the burden of disease through, strengthened health systems in the continent. And this is one of the areas that we have really, partnered with all of you to ensure that we really can ensure the health of the continent. Yeah, next slide. Yeah, so this slide will give us a quick, reflection of the journey of Africa CDC, and I'm sure many of you may already have an idea, that Africa CDC was officially launched in 2017, but the whole idea started way back from 2013 in Abuja during the AU Special Summit. And we've seen this progress out of the, the health threats that we've had in the continent. In 2014, we had the Ebola outbreak, which again reignited the thinking that we really need a health body within the continent that can help, spearhead some of these responses. And so finally, in 2017, Africa CDC was officially launched. Now, going to the next slide, it more or less then gives us a quick reflection on then the journey on how we have grown. we talk of Africa CDC to be 5 years or 6 years old now. But then the amount of work that we've done, and again, through your support, is quite enormous. And we have, since our inception, what we will say is that we have, centralized the importance of building strong and adaptive partnerships. And that's why we've been able to survive through with all of you based on the support that you've provided. If you look way back in 2017 when Africa CDC was launched, then we started with the initial support from the member states. And this has grown. Going into 2018, then we saw some of you partners like the Gates Foundation coming in handy, to provide some of the initial support that was very critical, human resource for Africa CDC to stand. And then we looking at 2019, then we started having many of you partners coming on board. We see the World Bank, giving the initial support that went into Ethiopia, Zambia, and Africa CDC. Now, looking at 2020, 2021, you'll see that then our partnership has grown from about 2 or 3 member states at the beginning to now what we see more than 75, partners that we've engaged and signed, memorandums of understanding, and we're already working together. So the next slide then, will tell us what does 2020 mean to all of us. And for us, 2020 has been, a banner year for Africa CDC for the reason that, the trust from the member states on the efforts that Africa CDC is doing was codified through the approval of the Africa CDC as an autonomous body of the AU. And that really means a lot because then it gives us more of operational, autonomy, and that would even make our work a little more easy looking forward in terms of how we operate and how we engage with all of you. But then we've seen also in 2020 some of the key, milestone partnerships that have come on board. We've had, the MasterCard Foundation, the World Bank coming in to provide very critical support into the work that we do. And again, I mentioned the two, but I don't mean only MasterCard, only World Bank. We have a whole of you here who've been very, very supportive in the work that we do, and we really want to appreciate that very, very sincerely and look forward to how best we can strengthen these, growing partnerships. So we wanted to take a moment and quickly run you through what we now, in 2022, we are looking at the new public health order as a guiding, framework for public health preparedness in the continent. And again, this is highly linked, to the very well linked to the overall Agenda 2063. So we have 5 key pillars of the new public health order. But I really wanted specifically to really discuss more on Pillar 5, what we call respective action-oriented partnerships, which really we want to strengthen by the way we engage with all of you. And again, make sure that at the end of the day, the kind of partnerships that we get into are partnerships that are beneficial to all of us, and that will ensure that we really achieve the security, the health security of the continent. So the next slide tries then to go deeper to really, break it down. What do we mean by action-oriented, respectful, and action-oriented partnerships? For us, it's very key that the priorities that come up are, Africa-defined priorities, but above all, aligned with what we call, continental priorities. That is very, very key for us, because going forward, and if we have to achieve, the Africa we want, what is contained in the Agenda 2063, then it's very key that we are aligned to the overall priorities of the continent. But more so, again, we want to see partnerships that are more coordinated. And we really appreciate then that you take time to come and sit with us here, review some of these things, and together we can chart our way forward. How best do we become more coordinated in our support, the work that we are all doing within the continent? And of course, trust and effective partnerships, committed partnerships, and above all, and I mentioned this, that we want a partnership that has mutual benefits and understanding. We do understand very well that many of you partners already have your own priorities, but also the continent has its own priorities. That alignment is very key, and that's why we really want to ensure that we have the trust that you need as we engage, and that we are all coordinated, and that there is mutual benefit in all that we do. Now, as I come to the end of this quick presentation, I just want to highlight a few things. One, that cutting-edge adaptive partnerships are central to supporting the continent in achieving the goals under the new public health order. And really, that's why we want to ensure that we can walk this journey together with all of you. And as we look into the future, the aspirations of Africa that Africa has on the public health preparedness agenda is quite visionary. And we can't achieve this vision alone as Africa CDC, but we have to work together with all of you. And again, realizing these aspirations, is so critical for the continent and for the entire globe. Experiences that we've had, from the recent COVID, pandemic, the COVID pandemic, is that, none of us is safe until all of us are actually, protected. So it's no longer that we want to work in silos, but ensure that we are coordinated, because then what affects us in the continent will, cross over to the other continents. Now, one of the things we would have wished to demonstrate more here, but again, this is happening, is really we wanted to bring it out strongly. What does the partnerships that we are enjoying with you all mean for Africa CDC? Now, over the last few days, and I'm sure many of us have had a chance to attend the various side events that are going on, the side events more or less demonstrate some of the key achievements we've made through the partnerships that we've enjoyed with all of you here. And that is really a demonstration on what those partnerships means for Africa CDC. And so we really want to thank all of you and look forward to further engagement, and also see how best do we ensure that we are more coordinated as we move forward, and how do we contribute to the entire, thinking around the new public health order. Thank you very much.
Thank you very much, George, and of course, for setting the pace for us for the next fireside chat that I'll be having with Dr. Ahmed. Please, a round of applause for that informative presentation. Thank you. Dr. Ahmed, I'd like to call you on stage for us to have a quick fireside chat to discuss more on this ambitious agenda of the new public health order and much more. Thank you. Thank you, Dr. Ahmed, for joining me this evening. As we start off, of course, we've just heard from Mr. George. He's given us at least the 5 pillars to quickly take us through the new public health order, which of course we will agree it is quite an ambitious agenda. But why is this framework so important for the continent, and what foundationally needs to be done for us to see this vision being actualized today?
Thank you, Fiona. And the new public health order is a vision that comes out of gaps. I am not saying failures, but sometimes it sounds like that. But it comes out of gaps in addressing the continent's needs, particularly in the health security space. It can actually be easily translated into other parts of health in general. So those gaps have resulted in our continent's inability to act quickly when there is an outbreak. And it has also resulted in the very unpleasant experience where you're sitting somewhere and you are watching someone having a good meal and you're hungry, meaning we do not have access to that meal. So out of that, there was reflection on what needs to be done differently so that we can actually have access to that meal when we are hungry. And that's how the new public health order came into fruition. Now, of the many things that we need to do to make it happen, the three that are very critical for me are: one, we need to have this conversation at all levels so that there is understanding by all who are concerned. The very senior of us leading countries to the very junior of us who react to, who are in the front line whenever there is an outbreak, and everyone in between, including our partners. So that understanding is important for the second reason, which is there is need for our resources to follow those priorities that we have set. So apart from the understanding, then whatever resources we have, and domestic resources are absolutely the most essential because it is what starts the process of implementation. So when those resources follow the priorities that we have set, then we know that we're on the right track. Finally is we must document what we are doing. Otherwise, we cannot be able to track the success or otherwise of the new public health order. So these are the three things I would say to me are quite important in addressing the implementation of the new public health order.
Dr. Ahmed, I like the fact that you talked about documentation. Documentation is something we lack, especially when it comes to keeping data. Then how else do we change this? What will be the game changer to make it the most priority that everyone that lives here this evening knows this is the top priority that we focus on, especially when you talk about documentation?
Health professionals generally are very poor at communicating their success. Even failures, we are very poor at communicating that. So for me, we need to begin the culture of capturing every action and information that comes out of our work. And that's why our digital transformation strategy is very important, because when we use technology, we can be able to do that in real time. But we must capture that work that we are doing on a continuous basis. Not that when the end of the year comes is when we are setting how many malaria cases did we see, we start trying to remember. That doesn't work. Yeah. If we do it on a real-time basis, whenever it is needed, it's a click away. So this is one very important thing that we need to do, just tracking what we are doing on a daily and a real-time basis. The second thing that we need to do is regular reflection. After 3 months, where are we? Do we need to readjust our direction? Is there something that we could have done better? Is there something we are doing we shouldn't do? So that regular reflection is a very important part of getting us onto the right track and ensuring that we are going in the right direction and at the right speed of implementation.
Absolutely. Now, achieving this vision, of course, will require a lot of collaboration through partnerships across the wide range of stakeholders, I'm sure, from government to private sector partnerships, donors. What is the future of partnerships from the perspective of Africa's CDC?
The future of partnerships, when you see the number of partners that are here, is very bright. When you have one focus that you're chasing, like COVID, then we come together very easily. When there is no one item that you're chasing, then usually everyone goes into their own modes of prioritization. But for me, the future of our partnership is bright because we are already speaking almost the same language, the language of the new public health order. The future is bright because we have results to show for what partnership has done. And George has just shared the exponential growth from 2-3 partners 6 years ago. Today we have 100 plus MOUs. Now, the partnerships that are there without MOUs are probably triple what you're seeing, because we're engaging with a lot of different institutions. So we have history. So for me, the future of partnerships is good. But to ensure that that future is secure, we must base it on something concrete that is of value to both sides. And that which is concrete and is of value to both sides are the priorities of the continent. When we focus on that, the rest becomes mechanics for delivery.
Priorities of the continent. Dr. Ahmed, you'll agree with me that most of the times we have international organizations that come in with their own models. Maybe they do not really prioritize the Africa that we are looking at, on the Africa that we want today. How can we change this to make sure that these models that we are either emulating or rather have also been brought to your table a number of times, I believe, how do you make sure that it speaks the African language?
Evidence. If a previous method gave a certain type of results, which was not what we expected, then that is good evidence that that model is not working. The current model that we have and we are implementing, where we prioritize what is the priority of the continent, is a model that works. And we have shown that by evidence. So as we go redesigning the way in which we engage with each other, particularly here on the continent, but also globally, we need to follow the evidence. And one example that I would like to give is we have a lot of international legal instruments that are designed to guide the way in which we engage with each other in the health security space, whether they are treaties or they are agreements or they are guidelines. We need to go to the evidence. How have we used those instruments to deliver for health security? If we find that the instruments are working, then let's continue to implement them. If we find the instruments are not working, then it is time to change either the way we are implementing the instruments or we change the instruments themselves. So it is evidence that carries us forward, and when we document well, it means that getting the evidence is going to be easy, and therefore the future of partnership where I sit is going to be bright if we use the evidence.
Absolutely. What then will you say is